Hi, myself Dr. Apoorv Sahu, and I am an orthodontist, a braces and a aligner specialist. I am practicing in Pune since last 8 years, and I am going to talk about some topics related to braces and aligners. My first topic, which I would like to discuss with everyone, is about aligners. Why aligners? Basically, because many of my patients and my friends are confused. What basically are these aligners? Which aligners should I choose? And are these DIY aligners good for me? So I have divided my topic in such a way where I could tell you in detail about what aligner system is. So I've divided into 3 or 4 topics. So the first topic first, what are aligners? So aligners are basically a series of thermoplasticized thin clear trays where each tray is incorporated with an incremental carefully planned tooth movement starting from the original tooth position, which is your malocclusion, to the normal occlusion, what we really want both in aesthetics and function. So the second topic being, which aligners should I go for? So friends, let me tell you one thing, that these aligner systems are not new system. If we go into the history, this first setup was basically tried and done by Dr. Kessling in 1946. Though it was not a digital way to go for it, but definitely this concept started from there. Then in 1998, Align Technology, they came up with the digital part of aligners, and from where basically this digital transformation started. So in India also, the first companies who started these aligners, basically all this started in 2015 and 2016. In 2016, Align Technology with the name of Invisalign came to India, and now in this current scenario, there are more than 130 registered companies who are providing this treatment to you all. So I really understand that this will be so much of confusion for you all to which brand to choose when you are talking about aligners. Okay. You should not choose aligners company based on your budget. Budget should not be a factor to go with one brand and not to go with the other brand. The factor to choose the brand of aligners should depend on the severity of your malocclusion. So, my dear friends, let me tell you what basically this malocclusion is. Malocclusion means how severely your teeth are malaligned or how complex your case is. Is it a really simple case where you just have a gap between your two teeth, or even your jaws need to be changed the position to get a good bite? Our teeth don't have only one function. It is not only about the cosmetic part. When we're talking about braces and aligners, when I do treatment for my patients, we look after two factors. One is the aesthetic, and the most important factor is the function. Function means how good your bite is. So, suppose if you have a gap of 2 millimeters, it's not about just closing that 2 millimeter gap in front, but your bite should also be good at the back so that you'll be able to eat properly with it. And it also is a big factor for the relapse case. If the bite is not good, your case tends to relapse again if you are biting from your front teeth again and again. Okay, so I divide basically these malocclusion into three types: a simple case, a moderate or a medium case, and a complex case. Complex cases are very simple. Whenever you require extractions and whenever you have a very deep bite where your lower teeth are not visible at all, you should go into the complex category. Moderate categories is where you don't require all four premolar extractions but one or the other tooth to be extracted, a mild deep bite, and a generalized spacing where you have space in each and every area of your teeth. And a simple or a light case comes into the category where you have just a basic gap in the front teeth. So, which aligner brand to choose? Well, please leave this option on your orthodontist. Orthodontist is the best person for you all to choose and to decide in which category your case is in. Is it mild? Is it moderate? You might feel that it is a very simple case. I just want to close the 2 space, but sometimes it is not that easy. So please, my dear friends, let your orthodontist decide what category your case is and how complex your case is and which brand is best for them. Talking about the third factor, that is the time and the cost factor. Okay, So first, let's talk about the cost, because I know that this is one of the most important factors for you all. But as I said before also, don't choose an aligner system based on your budget. It should be based on the complexity of the case. For example, if suppose 70,000 is a big amount for you all, but your case is a complex case. So don't compromise by just closing the midline gaps and let the bite be in that same old position, and that will create a big problem for you all. So better to you go for a good braces, metal braces which are in your budget. Definitely in 70,000 you will be getting a good metal braces or a good ceramic braces also sometime, depending on which area you stay in. So if budget is an issue, go for braces, either metal or ceramic. Okay, and cost factor, because companies like Align, Invisalign, or maybe even Clear aligners, they all basically start from 1.5 lakh onwards. It ranges between 1.5 to 3 lakhs for the whole treatment, and if you go for any good Indian brand, the cost will range anywhere between 90,000 to 1 lakh, and it can go up till 2 to 2.5 lakhs also. Extraction cases are very difficult, and that will require a lot of refinements also. So it should be the factor where this cost should not be a repetitive cost for you all. Make sure that you are very clear with the brand you're choosing, that suppose they show you something in your video, a treatment plan. I will call that a video only. It's like a video game that they're just changing the position of your teeth and saying that this will happen. But suppose if that doesn't happen, then what? Are they going to charge you again for that set of new aligners, or it is included in your cost till the time you don't get the desired results? Okay, so this cost factor should depend also about the recurrent cost. There should be no recurrent cost to you, even if the teeth don't track properly. Time factor, yes, in time factor, I would say that Invisalign wins the race. Okay, now when we talk about the Invisalign aligners, the aligners which Invisalign have, the material is a smart track material, and they say that you can change your aligner in 1 week. Like in 7 days, you can change the one aligner. Now, if suppose, let me give you an example how time can be defined. It's a simple case, and you have a gap of around 2 to 3 millimeters. Okay, so if Invisalign is saying that you will require 12 aligners to finish your case, and X Indian brand is telling you that it will require around 15 aligners to finish your case. Okay, so when you're talking about 12 Invisalign aligners, you're talking about 12 weeks of active treatment. So 12 weeks, if you divide, it is just 3 months to 4 months. Ideally, it's only 3 months. But if you go for any Indian brand or any other brand, when they say that you have to wear one aligner for 15 days, so then the same treatment will take around 6 to 7 months to finish. And also there might be an extra time for the refinement. Once your teeth sets are over, then again you might require some X amount of numbers to get a good finishing and detailing of your case. And if it's a complex case like a deep bite or an extraction case, even Invisalign requires 35 to 40 aligners, or maybe sometimes 50-55 aligners also, that is active 1 year. But the same treatment in any other brands will go up till 2 years, because you have to wear one aligner for 15 days. So the time doubles up. So if it's an extraction case and if your budget is not going for even a good Indian brand, better to go with braces, because even braces will finish your treatment in 1.5 to 2 years. So coming to the last part of the video where I was going to talk about the DIY aligners, my dear friends, I want to make a new video for that. I'm not gonna add this in this only, because that is a very important topic, and I would like to tell in detail with proper articles to show what are the disadvantages of an aligner system who goes to your home and does your treatment. Because Virat Kohli and Anushka Sharma can just say that in their ads, it is an easy peasy tootsie solution, but once if they want to do their treatment for themselves or for their daughter, they will never choose the same. So let's talk about that in another video.